Good afternoon, everybody. Welcome back to another edition of Ramblings of a Grumpy Old Man. So, in yesterday's video, we alluded to the fact that today we were going to cover some more topics and my feelings on those topics. And we alluded to the fact that today we were going to talk about abortion. So, yesterday, Vice President Harris made a campaign stop in Georgia. And at her campaign stop, she had family members of two ladies that had passed away due to preventable situation, because our doctors have gotten to a point to where they are afraid of criminal prosecution if they perform simple life-saving procedures. What have we become as a country if we will allow people to die because a doctor is scared of going to jail if they save a person's life? You know, when I was coming up, you save a person's life, you were deemed a hero. So now we have a situation where a lady is in a situation where pregnancy has caused a threat to their life. And we're not allowing doctors to perform procedures to save that individual because it involves the taking of another life. Now, I say it like that. Both of these situations, my understanding, were due to, at least one of them was due to acquiring an abortion pill, taking the abortion pill, it not completing, and the lady needed a D&C, and the doctors wouldn't do it to save this individual's life, even after the medication has already been taken, the abortion performed. Now they can't go in and take care of what wasn't expelled in order to save this woman's life. What have we become? So, my views on abortion. I've thought and thought and thought some more on my views on abortion. I don't have any religious views that sway me one way or the other. So I kind of have to take that off the table. For me, personally, I believe that all life is precious. So I guess in that term, you could put me in the category of pro life. However, I also believe that we should not stand in the way of people's personal choices. I've said it on here before. I may not be your personal choice of who you want to vote for, and that's okay. You're allowed to make that decision. Why do we feel as people that we know better for somebody's body than they do? There are lots of reasons that women seek abortion. I believe that a lot of pro life people think that there are women out there using abortion as a form of birth control. I, however, have more faith in people than to think that there are people out there willy-nilly getting pregnant and going out having abortions. Are there circumstances where things have happened and that person is not ready for a child in their life and then they seek out an abortion? Sure. Do I think that a 12-year-old who has been a victim of incest needs to carry the child of a parental figure to term and have that baby? No, absolutely not. Do I think that a lady that finds out early in a pregnancy that it is a life-threatening situation for them needs to have access to an abortion? Of course I do. This is a touchy topic for a lot of people. That's why I figured I was going to try and cover it so everybody would know exactly where I stand on it. Florida has an initiative on the ballot voting for or against 6 weeks. 6 weeks. Most women don't even know they're pregnant in 6 weeks. Let that sink in. Most women don't know they're pregnant for 6 weeks. So please tell me how your laws, abortion bans, whatever you want to call them, make common sense. They don't. I'm all about common sense, people. Think of it from a common sense perspective. Common sense also tells you that barring any unforeseen circumstances, that there are no women out there who are 6, 7, 8, been put out even 9 months into their pregnancy and decide, oh, you know, this was a really bad idea. I'm going to go have an abortion. So, for a procedure to happen that late in a pregnancy, would take a catastrophic event. Maybe the baby's not viable. Maybe the baby has a condition to where it's not going to live outside the womb once it's born. It's a terrible situation, and I would hate to be in any parent's place that would have to make that decision late in the pregnancy to find out that I've been carrying this child and I love this child, but it's not going to live outside of my body. Then they have to dig deep and make a personal decision. And I don't think that there's anybody that would decide that I'm going to go ahead and birth it naturally, even though there is a 100% chance that this baby is not going to be viable outside of the womb. So what does that look like? Common sense would dictate that, in my head, 12, 16 weeks. Now, there are people out there that will say that, you know, heartbeat at 6 weeks. Yeah. Jellyfish have a heartbeat too. So for me, at what point do I feel that it's acceptable? And again, I'm going to stick with between 12 and 16 weeks, somewhere in the 3 to 4 month range, up to that point. Now, if there are extenuating circumstances and exceptions, I feel like that possibly that should be extended given the circumstances. And we can all talk about what those circumstances look like and what should happen. And there are people out there that will say, oh, you know, instead of having an abortion, go ahead and have your baby and then put it up for adoption. So, for those people, let's go back to the case of the 12-year-old that was impregnated by a parental figure. You want this 12-year-old to carry this baby to term, go through the birthing process, one of the most dangerous things that a woman can experience in her lifetime, regardless of whether it's been a great pregnancy or a bad pregnancy. Giving birth is still one of the most dangerous things that a woman will do in their lifetime. And you want this 12-year-old to go through this process and then what? Give the baby up for adoption? Keep the baby? Mentally, I feel that that would be more detrimental to that 12-year-old being forced to do that than the abortion process. Now, abortion is not something that is done lightly. I have had situations in my life, not me personally, but I have been involved with people that have had to make that decision. And it is not a decision that they take lightly. And believe me when I tell you that even after the procedure, they carry that with them for a very long time. So we've got the medical problems that can arise, the medical perspective. We've got a mental perspective that also has to be taken into consideration. And as I've stated, I'm pretty sure that because as I've also stated previously, there's exceptions to every rule. And if you make a law, somebody's going to try and circumvent it. I don't believe that there are people out there that are using abortion as a form of birth control, which I really believe that probably not all, but there is a portion of pro-life people that really believe that there are people out there using this as a form of birth control. And believe me when I tell you that birth control pills, shots, whatever, are cheaper than abortions. And use your head, people. So there you have it. Personally, pro-life, but don't think that the government needs to be in the doctor's office with the doctor and the patient. I think government needs to keep their hands off of the female body. I am living in a time now where my daughters, my granddaughters, have less rights medically than they did when they were born. And to me, living in the greatest country in the world, we should be progressing forward. And by enacting these abortion bans, overturning Roe versus Wade, the Dobbs decision, we're back to the 1950s. Maybe even further back than that. So, if we want to keep moving forward as a country, we have to keep evolving. Lifespans are increasing. Technology is increasing. We learn new things every day. And there may come a time where that baby today may not be viable outside of the womb. But 10, 15 years down the road, hell, somebody might even stumble on something next week that will allow that precious life to be viable outside of the womb. But until that time comes, we need to figure out a way to be able to save the life of that mother. Imagine this. Let's put together a hypothetical situation. I don't think there's anybody that may be listening to this video. Well, there may be some people that listen to this video that have never experienced the death of a loved one. I, however, am not that person. I've experienced death many times in my life. Many people that I love, and I'm sure that most of the people watching this video have also experienced such a thing. So, let's set the hypothetical for you. You're in a loving relationship. Your partner is pregnant. Your partner has found out, you and your partner have found out that the child is not going to be viable outside of the womb, or the child is going to cause some medical condition that is going to endanger the life of the mother. And you live in a state such as Florida, 6 weeks. You're past the 6 weeks mark. You've got no exceptions. What do you do? Well, on one hand, which seems to be the more popular one, is you figure out a way to travel to a state where there's not a 6-week ban and you are within the guidelines of that state, and you go and you seek medical attention in that state. That is asinine. With medical deserts existing, and I use that as, to me, a medical desert is anywhere that you live that you have to travel more than 35, 40 minutes, sometimes up to an hour, outside of your area to seek medical attention. And there are people out there that probably need to travel further than that. So that's not a viable option for some people. Maybe they can't afford to take a week off from work and travel out of state to go get a life-saving procedure. I don't know what people are thinking. I can't comprehend in my head. Now, getting back to the hypothetical. Okay, you can't go to another state. So now your hands are tied. You're forced. You know that this pregnancy is going to cause problems with the mother. As the partner of that person, now I'm stuck in a situation. So your decision has not only affected the mother, now you've also affected the partner to the mother. Now the mother is being forced to carry that baby that we know is not going to be viable outside of the womb. When the baby is born, the baby is gonna die. And you prepare yourself to deal with that situation. And now your partner also dies. Now you're grieving too. Some people are going to say, well, grief is grief. You grieve for one, you grieve for two, you go through. No. When it could all be preventable. And we would only have to be grieving the loss of one. And I don't know if you've noticed, but grief for people is a terrible situation. People do crazy things when they're grieving. So the longer you know somebody, the more you grieve when they pass. The longer it takes to get over it. Now, I am by no means saying that if you come to the conclusion that you need to have an abortion, that the grieving process should factor into your decision. It's gonna factor into your decision. And it's gonna be hard to make that decision. Nobody makes that decision lightly. And I really believe that that is where our politicians need common sense. Common sense. The doctor that we put our health in their hands are more knowledgeable than the politicians that we vote into office. Now, there are some politicians that are doctors. I'm not saying there aren't. But maybe, just maybe, we should be listening to the people that know the situation, the patients and the doctors. You don't take your pet to the small engine guy to fix his broken leg. Take him to the vet. So, why should we be trusting our career politicians who are maybe accepting money from Big Pharma, other organizations that have a monetary stake in people not having abortions? It becomes a very slippery slope. But if you stand your ground and you listen to your constituents, that's what it all boils down to. I can have my own personal opinion, but it comes down to, what do the majority of the people that I represent, how do they feel? What do they want? So I understand former President Trump takes great pride in being the president that overturned Roe versus Wade. For 53 years, they all wanted it back in the hands of the states. The problem with that, there needs to be a uniform position. Maybe, just maybe, we put it on the ballots and see where the American people stand on it. See what wins. You know, national abortion ban. To think that that's even a possibility scares the daylights out of me. There are a lot of women that have to make a decision every day. And I don't know, number one, I don't know if there's any politicians watching this, if it's making it to anybody. But I don't know if you've looked and checked things out, but women make up half of the electoral vote. If you want to alienate half the people in the world, you go right ahead. I, on the other hand, want to find a common ground where we can all agree. Everybody has a right to their opinion. So you're entitled, whether it be personal or religious reasons, that you're pro-life, that's fine for you. But think about your neighbor. Think about that neighbor that's beside you, that you live by yourself and you get sick, that neighbor comes over to help you. Maybe, you know, maybe you're riding your motorcycle and you break your leg and you can't get up and make yourself dinner. And maybe that neighbor fixes you dinner. Now, it's one meal a day, but it's one meal a day you don't have to make. Now, imagine that person that makes you dinner every day for 6 months gets pregnant. And you're pro-life. Now imagine that woman that has made you dinner for 6 months while you're healing comes in and has an extenuating circumstance and needs to abort this pregnancy. Or if she doesn't, she's not going to live through it. You still going to vote pro-life? Are you going to be against this person who, out of the kindness of their heart, helped you when they didn't have to? You're going to put your nose into their business that you don't have to? Now, I'm not directing that towards anybody in particular that may be watching this video. I did use an example of something that actually happened in my life. Not the abortion part. That was completely fictional and hypothetical. But I don't want the person that may or may not see this video, we do differ in political beliefs, to think that I'm accusing them of being pro-life or pro-choice, because I don't know their stance. I was just using a personal experience of something that happened that could set up a situation to where you would have to really consider whether your stance on abortion was a good idea or a bad idea. So, if the person sees the video, I'm not talking to you directly, even though you know I'm talking about you indirectly. Because as I said, I don't know your stance. And I'm not going to mention any names. But people, common sense, common everyday sense needs to cease being the change on the bedside table. So I think that you can pretty well from this video gather where I stand. So what are we going to talk about tomorrow? I don't know. I guess we'll just have to wait and see. Tomorrow may just have to be a surprise. So until tomorrow, this has been me. So you guys have a great day, and I don't know if you're watching the videos. I don't know if you care about my stances, but I hope that if you are watching the video, that I have at least said something that'll make you think. I'm not trying to sway anybody's personal opinions, but I do encourage everybody to try and see things from another perspective. You know, the saying, couldn't see the forest for the trees. Well, if you're overhead, maybe you can. What do I mean by that? If you're seeing it from a different perspective, there might be a clearing in the middle of those trees. It's a really nice camp spot beside some creek. Check it out. Dixon for Congress, 2026. Thank you. Have a great day.